Antioxidants combined together with chemotherapy and radiation. Again, this is the big, I find, contentious subject that seems to be brought up time and time again by patients' oncology team. Hi there, my name is Dr. Walter Lemo. I'm a naturopathic physician with a practice solely focused in cancer care for over 20 years. So the word antioxidants, which tends to be synonymous for vitamins, minerals, natural health products, tends to be brought up as a point of potential negativity, I find, by patients' oncology teams with certain chemotherapeutic agents and radiation, because some of those treatments potentially work by creating free radical damage or a rusting that occurs to damage the cancer cells. So then by applying antioxidants, it might potentially minimize that value. So, but here's a question a point that is not brought up. Prescription medications and over-the-counter medications can also have antioxidant capabilities, can be very potent antioxidants. And the question then is, how often is that brought up to patients by their oncology team? So this issue is the reason why back in 2014 I published a small review on this area looking at prescription medications over the counter that have antioxidant capabilities. That was published in 2014, so now almost 11 years ago, in the International Journal of Cancer. And just to kind of convey that, hey, if people are worried about integrating antioxidants together with certain chemotherapeutic agents and radiation, shouldn't it be all of them? So for example, one of the more stronger antioxidant medications that I know of, do you know what it is? The corticosteroids, dexamethasone. It actually calms down swelling and inflammation. It stimulates antioxidant defense mechanisms plus other things. But yet it's used globally by the oncology community as a standard of care. But yet when you look at the data using it, say, with and without chemotherapy and radiation, there's really not much out there, but yet is widely used. For example, there are all the list of medications that a patient may be on. Certain diabetic medications could be antioxidants. Certain stomach acid reducing medications could be antioxidants. Sleeping medications, anti-nausea medications, morphine has antioxidant capabilities, but yet is that brought up by patients, by oncology teams? And the answer I find is never. So again, it's not about trying to create any polarized area in this subject, but the truth of the matter is that this is what is actually true, and yet is never discussed by two patients in this manner. So anyways, now you know that when you hear the word antioxidants, it's like, don't just assume it's natural health products or vitamins and minerals and dietary, plant ingredients. It's prescription drugs, over-the-counter medications as well. And for some reason, tends to be missed in this discussion of antioxidants together with chemotherapeutic agents and radiation.